Maverick Physical Therapy, Thoracic Spine Matrix, Trupling, in the words of mentor Gary Gray, David Tibiero, and Doug Gray. Today, we've been talking about a lot of this stuff for a long time, but it's time to dig on in and prepare you with some assessment tools and mobilization tools to help further your genetic potential. I'm going to take you through a basic series of things that I'll start with to get a good feel and idea of how that mid-back is working with the hips and the rest of the body. I'll show you the little boxes I'll kind of break and categorize things down into, so that when I'm looking for overall qualitative symmetry throughout the body, I will use these as a very quick way to be able to kind of make some notches with regards to reproduction of symptoms kind of clinically, or a restriction from one side in comparison to the other side, whether it's out of sync, in sync, kind of vice versa, or one compared to the other with type 1 or type 2. We then have down at the bottom right here, so at the top here's kind of the stage 1 that I'll kind of go with first. Stage 2 here, my type 1 in sync, out of sync, right and left. My type 2 in sync, or my type 2 out of sync and in sync. And then my little trupling matrix down at the bottom, SFT, meaning, okay, that top line stands for sagittal. We have an X, we have an E, and we have an F for extension and flexion. We then have another X with regards to, in the middle row there, for frontal plane motion. We then have a right or a left for side bend right and side bend left. At the bottom, the third box, the transverse plane, the rotational plane right there. We have an X again, meaning X stands for kind of a neutral position, with then an R and an L for right and left rotation. I'm going to put this behind me due to the sun shining on it. It's very glary. It's probably going to be difficult to kind of read and see, but I'm going to jam you through the thoracic spine matrix kind of standing up. We're going to have probably several episodes of this coming on up. We're going to get progressively very sophisticated. We're going to start with some very, very basic general principles, although comparatively speaking, relatively speaking, they're quite complex compared to anything that's out there today, but a great way to really, really spiral your genetic potential. So, with that said, we talked about Gary Gray, Doug Tibiero. They talk a lot about trupling, and that's a way to signify kind of the three-dimensional aspect of motion. We're talking about the thoracic spine right now. We get a lot of motion in all three planes: sagittal plane with their flexion and extension, right and left side bend, right and left rotation, due to the anglage of the facet joints, the joints of the spine. They're positioned at basically 60-degree angles that enable a lot of great freedom, hence the word trupling in comparison to coupling, which signifies a couple signifying two, trupling, tri, standing for three, trupling, a combination, a sequence of all of that. So with regards to function, we as applied functional scientists follow this nomenclature with regards to the spine that is osteopathic based, functionally based, with regards to relative and real motion. And so when it comes to the back and when it comes to the spine, whether it's the thoracic, the lumbar, the cervical, we have what we call type 1 and type 2s. We've talked a lot about this before, so we have previous episodes we can dig into. Our type 2s signify a rotation and a side bend in the same direction. And a type 1 signifies, in its nomenclature for a reference point, that signifies rotation and a side bend in opposite directions. So for instance, if I had my right leg forward, my pelvis is in this left rotated kind of position. If I were to take my trunk and rotate to the right, it's out of sync because the pelvic girdle and the shoulder girdle are rotating in opposite directions. If my right arm was rotating in the same direction to the left as my pelvis would, we would call that in sync. So those are big key reference points first to giving us a good understanding in terms of what the heck we're talking about. So what I will first do with my screening and with my assessment, just a basic kind of pivot lunge matrix. And as I'm doing this, I'm looking posteriorly, from a posterior, so behind the patient angle, and then a side angle. I want to check out what that thoracic and lumbar spine are doing with the hips and with the feet and the ankles. These are all things that are giving me clues. And then I'm going to go with some frontal plane lunges with some opposite side and same side overhead reaches. And again, I'll do this and I'll compare this to the opposite side. I'm giving you a very basic kind of guideline principle so that we can get into the nitty-gritty stuff that I think is more funneling in terms of narrowing things down. We'll then go into a posterior lateral and kind of this medial or anterior medial kind of lunge. So looking at the hips and looking at the thoracic spine and scapulothoracic joint, and then we're going to go ahead and move in the opposite direction, posterior lateral to anterior medial. So same side, doing opposite side, rotational lunge. After that, we have two big dowels here. We'll get to the big one in a second. But I like to start to preset these types of motion. We'll start with the little dowel first, and we'll start with kind of presetting some things. So I like to start right off the bat. I like to go with a Type II. I like to go with a Type II, either in sync and out of sync. I'll go with just a basic staggered stance. Dowel in the left hand. I'm going to take my trunk in my hand. I'm going to preset the rotational plane so that I can drive the frontal plane. Just something that's worked well for me that I go to. I'll typically find that the frontal plane and coupling that with some sagittal plane motion can more often than not break things up. It's just out of habit. It's not obviously not how I treat everybody, but for the sake of what we're doing here, let's go with a little preset. Left rotation, and what we're going to do, we're going to go right arm then side bending and reaching overhead to the left. So we've got a Type II out of sync. I preset my rotation to drive my frontal plane, and if I want to see a little more kind of sagittal plane, I will reach backward and overhead on an angle. So a little posterior lateral, or even a little more posterior with the side bend. See what kind of reaction that I can get. What I would then instantaneously do is, comparatively speaking, because we're looking for symmetry, we will have episodes when we're going after this quantitatively with some kind of measuring tools and stuff like that. What I will then do is I will go then to the opposite side and compare. I'll preset with right rotation, and I'll drive with the left arm reaching overhead and to the right, and then I'll add a little more sagittal plane kind of driver into the mix as well. We can also, in these positions, since we drove kind of frontal plane, we can preset also with a little transverse plane. So we can preset this Type II out of sync with the transverse plane, and we can just come on in here and we can drive that side bend. So we preset in the transverse plane, we can preset a little further and just go with the side bend. If we wanted to take a look at and see, okay, with regards to maybe flexion in the sagittal plane, bringing that in a little bit more, what if we were kind of to preset in the transverse plane a little bit lower so that I can get my rotation and my sagittal plane kind of load to drive then my frontal plane, my side bend for the Type II. And again, we would do that same thing over on the other side to compare symmetry-wise. Preset with the dowel and drive. We're looking again through that spine to see some good contribution for every segment. Up kind of through that little curlicue up through the back of the spine. And the same thing, we'd preset with a little kind of sagittal plane and transverse plane to drive the frontal plane. Our Type II in sync, and post this, we're going to preset in episode 2. We'll preset some frontal plane and do the same thing. So let's go with a Type II in sync, rotation and side bend in the same direction. But what we will do now is go back to the rotational, so the transverse plane, kind of preset. So foot can either be nice and flat, or turn that so it doesn't fall on over, or the heel off the ground to go after kind of the hip a little bit as well. Take a look how kind of that is and working, and more on that later because we'll use a lot of these for hip assessments as well. We can also, with that, kind of preset the transverse plane. We can preset the transverse plane and drive with the frontal plane, and we can go back to the again with the preset transverse plane, and as we're driving frontal plane overhead And to the left, let's go overhead to the left and behind us to bring in that sagittal plane a little bit more, because everybody is able to successfully or more successfully move in a combination of some dimensions more than others. Rehab, we've talked about a lot of times, can be very negative, degrading phenomenon in which it places everybody in the same category, comparatively speaking. It makes it evidence-based rather than customized and hypothesis-based, based on the truths that we know to be true. So we can then preset with a little transverse plane and a little sagittal plane with flexion and drive that side bend. So regardless of what the individual's function is, if they're limited, let's say a golfer, a tennis player, a baseball player, a softball player for throwing, pitching, whatever that is, if they're not successful biomechanically in the ways that they need to, we can go to other dimensions to biomechanically open up and unlock things to transition and transform overall how we need to move within their scope of function. So, and then we, comparatively speaking, go over to the right side, a little Type II in sync. So we preset with that rotation first, and I'll go anywhere from the side of the right hip to basically off of the right heel with both feet pointed forward to get an idea of basically how much motion I can get, and a lot of times starting with a smaller stance because we'll take up a lot more slack. If we give someone a little more motion to move, it's going to be a little more productive with that. And then we can drive a little bit more of the sagittal plane instead of just overhead to the right, but then behind us. We can, with the preset, we could also, I know in the, when we preset with the transverse plane and then driven with the frontal plane, kind of from down below right here, so that we're bringing a little more flexion into the equation, we could also preset with the rotation and the flexion right here with these kind of the same side arm, driving the other arm overhead. So there's a lot of different ways that we can combine and taking kind of a look at the Type 1 and the Type 2. So to open things up, there's Type 2 in sync and out of sync. We're next, in the next episode, we're going to take a look at Type 1 in sync and out of sync. Or actually, we might try and get that out of the way. Hash that out right now, like time-wise. We're trying to stay within that 15-minute kind of guideline. We're then going to progress to some preset frontal plane positioning with transverse plane driving, and then opening all of them up at the same time, and then progress into some walls. Type 2 in sync and out of sync, a basic start and foundation first with the nomenclature, the dialogue with regards to the biomechanical consistency and the tripling that are required to move well, to load from the bottom up and then also from the top down. Play around with those guys.